everyone.
Hello.
Now, I've been asked to cue us in because Francisca doesn't want to pronounce the word. What are we talking about today? It's called onychomadesis.
Okay, onychomadesis.
Yes, onychomadesis is actually an abnormality of the nails. And the reason we're talking about it now, especially after our last talk, which was hand, foot, and mouth, is because that's one of the side effects of hand, foot, and mouth. Hand, foot, and mouth, which is a viral illness caused by Coxsackie, can actually affect the growth of the nails. So sometimes it's amazing, but when I was in training, they didn't teach us about this. This is something that has come out over the years. I was in the US and a parent came in and said, oh, my child had a viral illness about a week ago. And then we noticed that the nails looked funny. The top nail looked as if it was coming off, and it was on every single finger of the nail. I mean, every single finger, nail on the fingers looked like it was like there was an underlying growth of the nail, and then the top nail was coming off. And I was like, oh my goodness, maybe he hits his hand, and this is to show you, I'm a doctor of 33 years, and the dad was looking at me like, Doc, there was no injury to his fingers. I'm like, let's do x-rays and let's make sure. We do x-rays, of course it came back normal. Then it was later on that we went and checked in the books and found out that after hand, foot, and mouth, after chemotherapy, after certain chemotherapy agents and other viruses, but hand, foot, and mouth is the commonest, the nail's growth can stop. Yeah. And remember, if your nail growth stops and then it starts again, that's an interruption in the nail growth. So you have an area where there's no growth. The nail that is right there where it stops starts to lift up the nail bed. And then the new nail, when it starts to grow, is pushing up the nail bed that had stopped growing. So we're going to show you a picture of it within the course of this talk. So when you have onychomadesis, people ask, so what is the treatment? That's a side effect of viral infections, chemotherapy. There are other reasons why people get onychomadesis, but we're talking about hand, foot, and mouth now and how common it is in children. And this condition, when you see it, there's nothing to do because the top nail is coming off. The underlying nail, which is new, is growing out. And you just need to trim the nail so that it doesn't become sharp or it doesn't end up getting caught on any fabric where it can be pulled off. And then that can affect the nail bed itself. Oh. So there's really not a whole lot to do. Onychomadesis is something that you've learned today. I only learned about it 3 years ago after doing an x-ray for a patient that didn't need the x-ray. Oh, wow. But in the end, the parents and we all found out together that this is a side effect of hand, foot, and mouth. And if you've been getting chemotherapy, you might have it too. Nothing to do. It will grow out. It might take time. It takes an average of 6 months to a year for the nail to grow. Because remember, the nail is slow growing. Well, for people who have slow growing nails. No, you don't have to cut it. You don't have to cut it. You just trim the nail as it grows. And that usually is the treatment for that. So you've learned something new today, onychomadesis. Yes. Nothing to do, just observe the nail. You don't need to be on antifungal. Some doctors have seen that and put children on yeast medicine, thinking that it's an infection of the nail, but it's not. And it's just something that you should know. So thank you everyone for listening in.
Thank you. Thank you very much.
Something new. We learn something new all the time.
Yes, and that's what life is about. You keep learning every day. So, catch you next time.
Okay.
Bye.
Bye.